Hunterdon Medical Center. I'm Gary Piscatelli, Administrative Director for Hunterdon Behavioral Health. We'd like to give you an inside look at the process, resources, and support that every person receives who walks through our doors. We want you to rest assured that our team of caring and compassionate professionals are here to support you and guide you through the process as your loved one receives crisis intervention services. The staff of the Emergency Services Program and Intensive Family Support Services will assist you through the assessment process, answer your questions, and offer resources to help you understand and cope with your loved one's situation. We recognize this is a very stressful and difficult time for families and friends. Please know that our commitment is to be there for you. Thank you for taking the time to learn more about what we do and for the privilege of allowing us to care for your loved one.
A trip to the hospital can be stressful and fraught with concerns of the unknown. So we'd like to shed some light on the experience. Many individuals come to the hospital on their own or with family and friends seeking assistance. Others present knowing something may be wrong but are ambivalent or unsure if the help they will be offered is right for them. Still others are brought to the emergency department by police or other law enforcement agencies from the community, and they are unwilling to consider assistance and are here because someone else believes they may need help. No matter how your family member or loved one arrives at the medical center, you can be assured that they will be treated with courtesy, understanding, and respect. After arrival, your loved one will register with a patient care representative who will inquire about demographic and date of birth information. At a later time, you may have the opportunity to assist our healthcare team by providing information about your loved one, such as allergies, past and current physician involvement, medication history, and background surrounding the current visit. All emergency department patients proceed through a standard medical evaluation process starting with a nursing triage, where vital signs and medical history are gathered along with additional details about today's visit. After triage, your loved one will be assigned a bed and then seen by a physician. Our physicians will perform their evaluation and may order lab testing or other diagnostic procedures such as an X-ray or blood work. These tests can be time-consuming and are often a cause of frustration for patients and families alike. However, knowing that the information being obtained may provide crucial understanding of any underlying conditions your loved one may have, hopefully the wait will be more tolerable. Once our physician determines that a medical condition is not causing the patient's symptoms, a behavioral health counselor will be called to conduct an assessment. This occurs when the emergency department physician requests a consultation. The counselors working in the emergency department are part of the designated New Jersey State Screening Center, which is located at Hunterdon Medical Center. They are a staff of well-trained and experienced professionals certified to provide mental health screenings in the community. The counselor will interview your loved one to gather needed information about today's visit. Depending upon the circumstances, this interview can be quite lengthy, lasting an hour or more. The counselor will also review the patient's past medical and behavioral health records to see if these shed light upon your loved one's distress.
Hello, my name is Nancy Ramore, Director of Community Outreach for Hunterdon Behavioral Health. While your loved one is being seen by the emergency room staff and behavioral health counselor, we want to offer you assistance as well. Intensive Family Support Services, IFSS, is a program to assist families who have a family member with a psychiatric diagnosis. Part of the IFSS program is CARE. This stands for Crisis Acute Resources and Education. To meet the needs of families in the midst of a psychiatric crisis, CARE provides immediate support, linkages with community resources and education. An IFSS family specialist is available to speak with you now or at any time you need. You'll be given a brief survey to complete and to return to the emergency staff. In addition, if you would like to speak to one of our family volunteers, please let the emergency counselor know and they will assist you.
We are often asked about confidentiality from our patients and families. Federal law, specifically the Health Insurance Portability and Accountability Act, known as HIPAA, restricts the ability of healthcare providers to disclose information about a patient's status to others without proper authorization. This can be frustrating to families. We make every effort to encourage patients to provide us with authorization so that we may involve the widest number of family and friends in support of the patient's care. In fact, if you believe that you have information which would assist us in providing better care to your loved one, please ask to see the counselor so that you may share a potentially important piece of the puzzle. After the medical and behavioral health evaluations are completed, treatment planning options are considered. It is the obligation of our counselors to seek the least restrictive, community-based treatment as a first choice. We will then link the patient to an outpatient service best suited to the patient's needs. This linkage can include a range of options: day treatment, partial care, group therapy, family therapy, individual therapy, substance abuse treatment, self-help groups, medication management, or even follow-up care with the emergency service itself. In the event that the crisis cannot be resolved in the emergency department and the patient requires a higher level of care, we will consider voluntary hospitalization. There are some instances where a patient who presents for evaluation requires hospitalization but is unwilling to accept treatment. These are cases where an individual is of imminent danger to themselves, others, or property by reason of mental illness. The decision to require hospitalization is made by the counselor and a psychiatrist. If this course of action is being considered, a psychiatrist will be contacted and will interview your loved one in the emergency department before making a determination. This evaluation can be extensive and may last up to an hour. The final decision regarding your loved one's treatment is the psychiatrist's. The counselor will still attempt to involve your loved one in their own care to whatever extent possible. If the patient is unwilling to work with the counselor, you may be consulted as a family member to assist in the selection of a treatment facility. No matter the path taken, all of us at the Intensive Family Support Service see ourselves as more than just a healthcare facilitator. We see ourselves as a part of the community we serve and treat every individual with the kindness, compassion, and integrity we would expect for ourselves. We're here when you need us.
We hope that we've provided you with a better understanding of what you're likely to experience when you come to the emergency department. In addition, I hope that we can alleviate your anxiety and help this process to be more effective for all that are involved, including you and your family members. Intensive Family Support Services is available to you free of charge through grant funding by the state of New Jersey. Our mission is to provide education and support to you and other families of individuals with a psychiatric diagnosis. If you take anything away from this video, please know you're not alone. We're here to help you to provide the type of services that you require during your time of need.